I wanted to ask Jenny, because as I don't know how many people on the oversight board know this, but a number of childcare providers, whether family or even those who work in centers, are being doxxed by individuals around the work, and the accusations of fraud and quite frankly, the lack of protections for the field. I'm wondering because anyone can make a public records request at this time and receive the personal information of staff that work in centers. So I want to know what the department plans to do to help protect the field, as well as to push back stronger on the fraud allegations. One of the things in reviewing the December report on childcare overpayments, it talks about where the issues happen, but it doesn't talk about the funds that are recouped, which I know in working in the field that happens quite a bit. So are there plans to share all that information to help counter this narrative? So about the fraud piece as well as protections for the field.
Yes, absolutely. So, a couple of things that are sort of forthcoming. So, I will first of all say that if you have more interest in some of the childcare conversation, uh, we have a presentation happening this afternoon in front of the Senate K-12 and Early Learning Committee, where our Assistant Secretary Nicole Rose and Assistant Secretary Ruben Reeves will be there talking about what we have in terms of fraud prevention metrics, and we are happy to also come to the board at a later date if interested, or do individual briefings if folks are interested as well in understanding a little bit more about what we have in place. So I think, thank you, Lois, for your question. We are obviously working very closely with our Attorney General's office in terms of what information must we provide, either for just generalized requests or in a public disclosure request to the department. And so as we have requests for information on individual providers, we are working with our Attorney General to determine what we are required legally to provide and where protections might be in place. You are correct. There are not a lot of protections in place on the information related to childcare centers or family homes, et cetera. Those would require changes in statute in order to protect that information from disclosure. And so we're again making sure that we can really follow the law closely. We have a very robust system in place, I think, as you were also sort of alluding to, Lois, to identify not just fraud, but also, right, we have situations where there are overpayments that happen, and those can originate through all sorts of situations. Often they are mistakes that are made, right, either in billing or even by us as the department in terms of there being sort of, confusion about what should have been paid out at a given moment. And if we identify those overpayments, we go forward with collecting on those overpayments. And so for providers, they have definitely experienced that, right, where we are identifying an overpayment and have collected on those. And those overpayments are referred to our Department of Social and Health Services Office of Financial Recovery. And they do a whole host of those kinds of overpayment recoveries, both for us and as well as for DSHS. Fraud has a level of intent to it, right? So you can have a larger set of overpayments, and there may be a subset of those and what we can see in our data is a very small subset of those are what we would call sort of actual fraud, right? And for those, if we suspect that their fraud may be occurring, we are referring those over to the Office of Financial Accountability, which is over in also in DSHS, right? And they actually are equipped to investigate and to make a determination of if fraud occurred or not. And they will also make a criminal prosecution referral as part of their process if they're looking into it. And again, they do that on behalf of multiple public benefit programs, not just childcare. I think it's important to note, so on the provider side of the house, so in addition to some of those mechanisms the two pieces that we are really have in place to identify and prevent any kind of fraud is first of all, we are doing unscheduled in-person licensing visits once a year. So if you are a licensed childcare, either home or center, you will get an unannounced visit at some point through that year. And if children are not present, right, because you can imagine a situation, say you have like kind of essentially an in-service day or something else happening and there are no children present, we will come back and do another visit to see when children are present so we can see how the facility is operating with children present. In addition to those annual on-site visits, we also conduct audits of our transactions, and we conduct audits both of families as well as of providers. And in 2025, we had 6,000, over 6,000 childcare providers and over 2,000 family, friend, and neighbor providers. And we audited almost 2,000 of them. And so that represents a sort of audit sample of 23%, which is pretty significant. For those of you who are familiar with statistics, right? Usually you can sometimes see samples of much smaller. And in fact, that's what we see when the state auditor audits is a smaller sample size than that. And out of those 23%, those 2,000 that we audited, only 14 ended in a referral to that Office of Fraud and Accountability group. And out of that group, we had no cases that were prosecuted and no cases that were convicted for fraud during that same time. So very small numbers is what we are seeing. We actually see a slightly higher rate in terms of cases that we send to that OFA on the family side of the house than we do on the provider side of the house. And that can be situations like, for example, that a family is not forthcoming about the composition of their family, the number of family members they have, for example, or changes in income, for example. So we see those types of cases as well. And I will probably stop there because I see hands.
Well, I'm just gonna just mention, Jenny, if it's okay with you, we might just go an extra few minutes because you have the next presentation as well, if that's
You're
okay
stuck with
you.
me for quite a while this morning.
Yeah.
So yes,
So
happy to
I think
flex.
we can continue. I'm not sure you answered the second part of Lois's
did.
question about childcare workers safety.
Yes, we have provided messages, to our childcare workforce. I think that the challenge for us is that clearly we are concerned, right? We do not want a situation where anyone is being harassed or feels threatened. And we have really encouraged our childcare providers to reach out and work with their local law enforcement in those situations because they're much better equipped to deal with those. In addition, we have been reaching out to providers that maybe kind of more vulnerable to those. We made sure that our licensing staff have made contact with with the providers that may be concerned, so that they can make sure that they're getting any kind of technical assistance or support from the department as well.
Thank you, Lois. Did you have a follow-up?
I do. So messaging is inadequate when it comes to protections. And so my follow-up question is, when family home providers have the option to opt out of having their personal information shared, in light of the threats, because I know that Senator Wellman had Bill 5926, which was set to just simply protect the private information of the child care center workforce. In light of the threats that I know DCYF is aware of, why is there no push to request that this information be temporarily withheld for the protection of the workforce?
Well, I think we spoke to this, and I would be happy to provide sort of a written response in coordination with our Attorney General in terms of the ability to have an expectation of privacy for this information. So we ultimately have to follow the law in terms of, and for Washington State, unless a record is expressly called out in statute as not needing to be shared, we have a legal obligation to share that information. We have, I believe, hopefully you know, Louis, we have explained to providers how they can manage and where they can manage their own information, because there's a variety of places, right, that information may be available to the public. And so we have had that conversation, but we have to follow the law in terms of what information has to be provided publicly. And I recognize that can put our childcare providers in a tough spot with the situation that we are in right now. And again, would just really encourage our childcare providers who have a safety concern to be working with their local law enforcement about that safety concern, because that is really the most appropriate the entity that is set up to respond to those concerns.
Senator Wilson?
Thanks. I just did have a response. And Lois, I don't know if you've seen Senator Hansen's bill related to safety and entrance. So you might look at that. I don't have a bill number, but I could get that to Lisha and we could send that on. That may be something you want to take a peek at. My question specifically, Jenny, was around once a family child care provider is licensed and they kind of launch their business, is there a period of time that it takes, and how do families find childcare, and how does childcare fill up, and what do we see when you get a license and suddenly do you have 12 people at your door, or how is it that especially new providers that come online actually get service supported and have families find them, and what's kind of realistic for that time frame?
Well, thank you for the question, Senator. And I think I probably am not well positioned. I think we might want to hear from a childcare provider directly, but I can at least tell you how we try to help families find childcare, right? So we have a couple of different options. First of all, when you call our call center and are getting sort of first approved, right, for Working Connections, we will make sure that you know some of the places that you can look for childcare. So obviously we have a contract with Childcare Aware, which is where, again, so I have a 10-year-old now, so I haven't had to search for childcare for a little while, but I am relatively close to it. And so I was actually would go on the Childcare Aware website, which will let you know and search for childcare in your area. So that would be one place that families could potentially find you, right? Sorry, Senator.
No, and I want to stop you because I'm not necessarily talking about families. What I'm kind of talking about is we have a lot of new providers, and I think we've had a lot in the news around providers without children in care. And one of the things that I know is a new site or a new center or a new home, there's a process that people go through just like a new business. So what is something that DCYF would expect, and when would you maybe wonder if there were kids in care or not in care? What would cause you, once you license, then you just let people go for a year? Or how is it that you know they're actually children in care, if that makes sense?
Yes. So let's break this apart into two pieces, right? One is that I want to recognize that we license all child care providers, regardless of if they take childcare subsidy. So, right. So from the licensing perspective, we are sort of setting you up and saying, go forth, right, and serve children. And we don't know if you as a provider are going to choose to serve families that are on subsidy or not. That is a business decision by that childcare provider. Again, we will go out and see you annually just to make sure that regardless of if they're subsidized children on subsidy or not children on subsidy, you have the safety and other licensing things in effect ongoing to make sure that all children that are in licensed care are safe, right? Ultimately is our first goal for licensing. then you may take subsidy as well, right? And so then we are sort of watching to see what, how many children you're taking with subsidy. And there is a high preponderance of licensed providers that take subsidy, children on subsidy, but not all. And so I do think it is a tale of a bit of, two stories there to some extent. And certainly, if we have a situation where, say, we again arrive at a child care center, we don't find children on site, we're going to have a conversation about why that might be, right? There could be all sorts of reasons that is happening. They just opened, to your point, and are still kind of building up their ranks. Although, if my friends are any indication, and my sister who is searching for childcare right now, I think we find those people pretty quickly, because there is such a demand for childcare out there for our working parents. The second piece, but then we would obviously again come back and see, and then the other thing that we would potentially do if we're concerned about that is compare to how we are paying, right? So we don't want a situation, right, where we're not finding kids on site and we are making significant payments. And in those kinds of situations, we would likely conduct an audit and or refer that over to that Office of Fraud and Accountability so they can kind of figure out like what's actually going on here. The last thing I'll just say is that, again, as somebody who pretty recently purchased childcare, I purchased a lot of childcare that my son did not use because he was sick a lot. And right. And I have seen that even in my son's K-12 system, programs, right, is that I can show up on any given day and there could be 2 kids in that classroom because the flu is making its way through, right? And so, or we're on winter break and families are taking breaks, right? Those are choices that families make in terms of their actual utilization of care, and that can lead to some of those kind of I think mismatches from a public perspective. And I think for those of us who haven't purchased childcare recently, kind of can forget how much unused care we all ended up purchasing based upon what was going on for our individual families.